You have literally today billions of social media posts talking about the vagus nerve.
The vagus nerve is a huge buzz term in the wellness world, being blamed for everything from anxiety to inflammation to trauma. You are one of the leading experts on the vagus nerve.
And when someone says to me, I want to stimulate my vagus nerve, I like to point out, yes, you have 200,000 vagus nerve fibers. Which one do you want to stimulate and how? It is possible to stimulate the vagus nerve. A common one that people talk about is humming. So why is that? Well,
does taking an ice bath actually stimulate the vagus nerve?
it depends how you do it. I actually prefer just doing it in the cold shower. You take a regular shower, step out for a second, put it on full cold, and step in. That initial exposure to real cold is a massive fight or flight stimulus, and this has been proved. So why do I do it? Well, because that's actually anti-inflammatory. But after you do it for a while and you stay in the cold, your heart rate will slow down, at which point you're clearly stimulating your vagus nerve. On a population basis, populations with lower heart rates live longer than populations with faster heart rates. The thing that slows resting heart rate is the vagus nerve.
Dr. Kevin Tracey, welcome to the show. How you doing?
I'm doing great. Thanks for having me on, Max. It's good to be here.
It's great to have you. I am very excited for the conversation that we're about to have. The vagus nerve is a huge buzz term in the wellness world, being blamed for everything from anxiety to inflammation to trauma. You are one of the leading experts on the vagus nerve, all things the vagus nerve. So I'm excited for the myth busting that we're about to do. But what do people need to know about the vagus nerve, how to properly stimulate it, if that's even a thing? Unpack it for us.
Let's start with basics. So we say the vagus nerve, but you have two of them, like two thumbs, two kidneys, one on each side. And it originates in your brain at about the level of your ears and travels down your neck on both sides, across your chest and into your abdomen. And all along the way, it's sending branches to all the organs in your body that you never think about all day long. Now, we say there's two vagus nerves, but each of those nerves on the right and left, each of them has 100,000 fibers that it's carrying. Each of those fibers has been honed over millions of years of evolution to do a specific task. It has a specific place in the body that it originates, and it has or it can originate in the brain, and it has a specific signal that it carries, and it has a specific job in keeping you healthy. And at the end of the day, each of those vagus nerve fibers is contributing to a specific reflex responses in your organs, and those reflexes are running all day long, so you don't have to think about your kidney or your pancreas or your immune system. All day long, the vagus nerve is one of the major conduits for reflexes that keep you functioning in what we call homeostasis, which means balance, which means health.
Now, how much of the hype that you see circulating within the wellness world on social media is real, and how much of it is misunderstood?
Yes and yes. You have literally today billions of web impressions, billions of social media posts talking about the vagus nerve. And that's not a bad thing, right? I mean, to the extent that people talking about it are encouraging healthy lifestyles and healthy behaviors, those are good things. To the extent that they're selling you something, I would just say let the buyer beware, and we can talk about that, why I say that. At the end of the day, when someone says to me, I want to stimulate my vagus nerve, I like to point out, yes, you have 200,000 vagus nerve fibers. Which one do you want to stimulate and how? And if you just kind of keep that in mind as we talk, it is possible to stimulate the vagus nerve. A common one that people talk about is humming. So why is that? Well, there is a branch of the vagus nerve in your neck that travels into your voice box, your larynx. And it's a branch of the vagus nerve, and it carries some fibers, maybe a few hundred fibers. So when you hum, those fibers can be activated because they control the airflow and the muscle tension in your larynx. In fact, surgery on the neck of famous singers and performers, it has to be very careful that you don't damage that little branch of the vagus nerve, because it can affect the ability to sing or speak clearly or change the voice.
Wow.
So if you hum, you've stimulated your vagus nerve. Is that really the same thing potentially as other exercises or modalities? Have you changed your heart rate? Have you changed your respiratory rate? Have you changed your GI function? Have you changed your kidney function? Have you changed the effects of the vagus nerve on your immune system? At that point, the analysis gets, well, at best, it's scientifically unproven, and at worst, it's highly misleading. That's where. Well, I wrote a book, as you know, to try to explain. This is what we know from literally thousands and most recently dozens of years of research across human history about the vagus nerve. This is what we know to be true. This is what we know is clearly false. And some of these interesting things that are being advocated on social media, these things should be studied. They weren't more careful study in large, well-controlled, randomized clinical trials that can be replicated and assessed for their value. That's where we are now for many of these things.
Now, the colloquial notion that stimulating the vagus nerve is wholly universally beneficial. Is that accurate or is that pseudoscience? I mean, like, is stimulating the what does that actually mean?
So that's a good question. What does it actually mean? That's the first place that when someone is giving you a recommendation to do something or buy something to stimulate the vagus nerve, the first question is what part of the vagus nerve am I stimulating? How is it being stimulated? And what's the evidence that this intervention has? We can't study the activity of those individual 200,000 fibers in humans. We don't have the tools yet. Someday we probably will, but we don't yet. Today we study that in mice. And we know from very sophisticated studies, some done in my lab, but many done at places like Harvard and the Howard Hughes Medical Institute and Columbia University, great medical centers and great scientists and colleagues, frankly, studying the vagus nerve, have been able to show that the fibers that go, for instance, from the brain to the lungs, have different jobs and function differently than the fibers that go from the brain to the heart or from the stomach to the brain. So we'll do another example. There's this idea that when you take a big breath in, that you've now voluntarily, if you will, changed your breathing parameters. As you inflate the lungs, you change the concentrations of gases in the lungs, you change the pressure in the lungs, and all of that information is activating signals that travel up the vagus nerve. Okay, up the vagus nerve, into the brain on the sensory side. So have you, quote unquote, stimulated your vagus nerve by taking a big breath? Yeah, technically you have. Now, when you exhale, through pursed lips or under pressure and take a long, slow exhale, you can feel your heart rate slow. If you check your pulse during that long, slow exhalation, you can actually feel your heart slow. But during your inhalation, it's sped up because the signals traveling into the brain up the vagus nerve activated the sympathetic fight or flight nerves to your heart, which speeds it up. And this whole complicated dance is occurring in collaboration with your rate of breathing. And this whole thing is called respiratory sinus arrhythmia. It's the relationship between your respiratory rate and the activity in the sympathetic nerves and parasympathetic or vagus nerves. So when someone looks at you and says, I breathe and I've stimulated my vagus nerve, well, yeah, you have, and you've stimulated a lot of other things too.
Yeah, I've heard, and I'm far from an expert in this topic, but that that's the reason sometimes it's said to slow down on the exhalation is to emphasize more of that parasympathetic side of things, right? To emphasize more of the slowing of the heart rate. Because
yes.
I mean, I think from the purposeful standpoint, people will usually engage with these kinds of activities to calm themselves down.
Correct. And the issue is, why are they calming down? So, see, I'm a scientist. I'm a neurosurgeon and a scientist. And so I have no problem with recommendations for healthy lifestyle approaches. In fact, I try to do them myself as well. I try to meditate every day. During that time, I pay attention to my breathing, in on 3, out on 7, trying to maximize what you just said, the vagal effect, or increase the vagal tone. I try to eat a balanced diet. I try to watch my weight. I try to exercise regularly. I try to get enough sleep. Try to be socially connected, and try to give back something to the world. These are all healthy things. Are they all controlled by your vagus nerve? I mean, you have 200,000 fibers. Which ones are you controlling with which? It comes down to it does come down to semantics. And the reason it's important is because from those semantics, you're one step away from people making concrete recommendations to do this and this and this in order to treat this, that, or the other thing. And right there now, the evidence is really weak.
Yeah. Well, there's a lot on social media. You'll see every day it's like a new protocol. And many of them are BS, just pulled from the podcaster's butt, so to speak. The science I'm taking from you is very preliminary, but yeah, people are fascinated by the science, which is why
that's a good thing.
Great book out, yeah. I've heard that 80% of the fibers actually send info up to the brain from the organs, the gut, the heart, the liver, the immune system, as opposed to the inverse, from the brain down to the body. What are the implications of that?
The implications of that are huge. First of all, you're 100% correct. I talk about the 200,000 fibers, but 80% of them are carrying information from your organs to your brain that you're not conscious of. Now, what we talked about reflexes briefly in the opening comments. Let's talk about reflexes for a few minutes, because that's kind of key to this whole thing. You're sitting in the doctor's office, and your legs are dangling over the table, and she hits your knee with a rubber hammer, and your leg goes up, and you said, "Who did that?" And that's a reflex. The way it works is that there is an input from the rubber hammer that stretches your patellar tendon, which activates sensory nerves in your legs, which go up into your spinal cord, and some of them may travel up into your brain. But almost instantaneously, within milliseconds, those incoming signals in the sensory nerves activate motor signals in your spinal cord that go back down to your quadriceps femoris, your thigh muscle, and your leg pops up, and you said, "Who did that?" Well, that is a reflex, and that reflex, like all reflexes, begins with an input. Something has to send a signal in order for a motor response or a reaction response to occur. Now, in the organs, you're not having obviously rubber hammers and stretching tendons, but you have changes in your insulin levels and changes in your glucose levels, changes in the blood flow or the pressure in your organs, changes in the oxygen in your organs. All of those changes activate sensory nerves. Many of them, when it comes from an organ, travel up in the vagus nerve, and that's the 80% input. Now, what happens next is just the source of incredibly fascinating work that many of us are trying to unpack, try to figure out. So we've learned, for instance, in the context of inflammation, that if you have the presence of inflammation in, say, your colon or your knee or your liver, that the inflammatory molecules, things called cytokines that we heard all about during COVID, cytokines activate signals in the vagus nerve that tell the brain there's inflammation in the body. That input can activate an output down the vagus nerve that sends signals that slow down the inflammation. That reflex control of inflammation goes back to ancient animals like roundworms and mice, and we have it in people. And because we could map these reflexes in the vagus nerves, we recently, a company called SetPoint Medical that's not far from here in Valencia, got FDA approval to implant vagus nerve stimulating devices the size of a multivitamin in the neck of people with rheumatoid arthritis. And that's now going to be a treatment for rheumatoid arthritis, because it's not putting in an exogenous molecule. It's not putting in an artificial inhibitor of inflammation that we made in the lab. It's actually putting in a nerve-stimulating device that is reactivating an evolutionarily ancient reflex mechanism to slow down inflammation.
So this has huge implications then for, I mean, you mentioned rheumatoid arthritis, but other autoimmune conditions I would imagine as well.
I believe that will be the future. I cannot make predictions without data. That's not how I ride. But we do know a lot about the effects of this therapy in rheumatoid arthritis, and based on that, that is the starting point. The FDA has given permission for the company to use this device to manufacture and sell this device. There's 1.5 million eligible patients with rheumatoid arthritis. But we know a lot of preclinical research, laboratory research about other autoimmune conditions in the vagus nerve, and the data are quite telling. I think very soon you will see, if it hasn't been announced already, a trial for this approach in multiple sclerosis. That'll probably be announced by set point if it's not already. You're going to see clinical trials in inflammatory bowel disease. We've already done some in Europe and reported on those in the peer-reviewed literature. You're going to see an explosion of interest in trying to build devices targeting the vagus nerve to treat diabetes and obesity and metabolic syndrome and hypertension. So yes, this is the tip of the iceberg. And because it can be done safely and because it's a therapy that's focusing on activating an evolutionary ancient reflex, patients want it. I mean, I'll just say one last thing to make this point. Setpoint's clinical trial for rheumatoid arthritis needed about 250 patients. This is about a year and a half ago. The trial finished last year. They had like 26,000 people apply for 250 openings. Wow. And this wasn't just send a name into a hat. They had to enter the portal, fill out all the questions and answers. So there's a tremendous interest and demand for this. And the reason for that is because the current therapies are immunosuppressive and have serious side effects and can cost a lot of money. So it's going to be interesting to see what happens now.
Totally. You know, I first became aware of the vagus nerve a couple of years ago. My mother suffered from a Parkinsonian condition. She had Lewy body dementia. And so the vagus nerve first popped onto my radar when I became aware of a study involving patients that had undergone truncal vagotomy. And they saw a stark risk reduction for the diagnosis of Parkinson's disease, which basically suggested that in some way Parkinson's disease might actually begin in the gut, and then using one of those 80% of the fibers that travel from the periphery up to the brain, that vagotomy seem to have prevented the spread of whatever was going on in the gut to the brain. What can you tell us about that study? Because that was fascinating to me.
Yeah, again, we could talk about this for the whole hour. I agree with you. It's an incredibly fascinating topic. So let's tell everybody first what a truncal vagotomy is. So if you cut the vagus nerve up in the neck, it's fatal. It's the only nerve in the body, if you cut it on both sides, that you die. And this was actually discovered back to the ancient Romans, ancient Greek physicians. Galen actually used to do a demonstration on laboratory pigs and even monkeys and chimpanzees and sheep. And when you cut the vagus nerve on both sides in the neck, it's fatal because you disrupt breathing and cardiac function. But if you cut the vagus nerve down by the stomach, that's called a truncal vagotomy. When I was training to be a surgeon some years back, that was an extraordinarily common operation. Every hospital, every day, every teaching hospital, every big medical center would do a handful or a dozen of truncal vagotomies to treat peptic ulcer disease because the vagus nerve signals regulate how much acid is being made in your stomach, and when you cut that, it stops. So the study you're referring to, because this was such a common procedure, there were worldwide millions of people walking around who'd had this procedure. And so I think it was in a country that had collected all of its. I don't remember if it was like Sweden or Iceland or something like that, where all the patient data was in one place. And when they looked, exactly what you said, that the risk of Parkinson's disease was diminished.
It was halved.
It was halved. Now, this has been studied in the laboratory, and as data is emerging about the various molecules that could be being produced in the gut by either the gut lining cells, the epithelial cells, or by the microbiome, by bacteria in your gut, those cells can and bacteria can make molecules that can find their way up the vagus nerve. I mean, lots of things travel in nerves. The rabies virus, that's how it works. The polio virus. So things can go up nerves from point A to point B, and that may be what's happening. What makes this so much more interesting is if you go back, and you'll probably, knowing you, Max, you'll probably do this, but if you look up the original description of Parkinson's disease, Dr. Parkinson explained that the earliest symptoms of the condition are gastrointestinal symptoms and constipation and other GI dysfunction. So, I mean, it's fascinating. We're not there yet for we don't have enough information yet about how it works and how to do it and how to treat it, but I think that'll come. I really do. Whether in the future, whether future people at risk of Parkinson's, whether we'll have better diagnostic tests and those people at risk will be able to be treated preemptively with a drug or a vaccine or an antibody or something to prevent that protein from going up the vagus nerve, it's very possible.
Do you think one day we'll discover that many of these brain conditions, where for decades, if not centuries, we've been looking for the root cause in the brain, will one day find that they originate down below in other parts of the body, the gut even?
I think so. I can't speculate on the 16,000 diseases that the NIH has named, with which of them will fall into this category. But I predict, like you, that some of them will. I mean, the one I think about, and I spent some time on this in the book to try to encourage my colleagues to study it further, is depression. And if you look now, vagus nerve stimulation was approved as a treatment for depression more than 30 years ago. And worldwide, because it's also been used for decades to treat epilepsy. So worldwide, hundreds of thousands of people have had vagus nerve stimulators implanted. It's safe. It's a one-and-done surgery with the new device anyways. The battery is labeled for 10 years, but it may well last longer. And even with the older devices, the batteries lasted 5 or 10 years. So for many people, this is a very straightforward, relatively minor surgical procedure. In the case of depression, it works about half the time. And so because it's not working 80 or 90% of the time, there's been a very slow adoption of this therapy into the world of depression. But let's break this down. No one knows what causes depression. It's not serotonin. We know that. There's no mechanism of action for serotonin that's ever been proved in any study that serotonin has a causative role in depression. But people take SSRIs based on serotonin biology, and many of them get better, and that's great. That's great. It just doesn't mean that serotonin is the problem in the depression that they have. Serotonin is also, SSRIs are also anti-inflammatory. We know if I inject you with a cytokine right now, like a TNF or an IL-1, in an experiment that we could do in my lab at the Feinstein Institute or elsewhere, and in a way that's being done every day in many hospitals, because these cytokines are used to treat various conditions, like cancer or other liver conditions. What happens when these people are treated with cytokines is they get depressed. The cytokines produce the loss of interest in working, the fatigue, the loss of interest in some people in their friends and families, and
self-care.
Their hobbies, self-care. So simply injecting you with too much of a cytokine will produce this. Now, we also know that vagus nerve stimulators decrease inflammation. That's what we were just talking about. So I've raised a question. I don't know the answer to this question, but it's a question that could be answered. Are the 50% of people who are getting better from vagus nerve stimulation therapy, are they getting better because their depression was being caused by or driven by, the mechanism of action of their depression is inflammation in their body, your original question, versus someone else who might have depression caused by some dysfunction of signals in a brain network unrelated to inflammation in their body. So the answer is maybe we should study that. And it frustrates me because if you got a family member with depression and it's serious, I mean, there's people out there who are suicidal, who can't take care of their kids or their loved ones and are in a really bad way. And many of these people aren't even being offered the possibility of this therapy, this vagus nerve therapy. And that also has to change. With all the information that's out there today, with all of the access that patients and their families have to new information, I think sometimes people have to advocate for, maybe we should try this. So no, it won't work in 100% of people, but there are people who were suicidal and in a bad way, and now they're back at work living a rich, normal life because they had a vagus nerve stimulator. So we have to be talking about it, and we have to do more studies.
100%. Yeah, I think, I've struggled with depression in the past. I think, there is an aspect of depression that's just par for the course of life, particularly today, but I think there is a sense for some that when you're depressed, there's like a moral failing that you shouldn't be depressed because it's something that originates, or that there's the sense that it originates from the mind. But what if it didn't? What if for many patients it actually originated in the body, which gives you a way to there's an actionable component to that, I think, that shouldn't be overlooked.
Well, I mean, where do you want to begin with that? What you just said is a very rich and important line of reasoning. Yes, depression is extremely common. And no, not everybody can will themselves back to being happy and not depressed. A great example is back to we talked about peptic ulcer disease, right? And for years, for decades, everybody knew that type A personalities, the person who was all revved up and stressed and had high charge, go, that those people had more, obviously have more peptic ulcer disease because they have more acid in their stomach. And the type B personality, more laid back, cum si, cum sa, they didn't have as much acid, and that's why. Wrong. The peptic ulcer disease is caused by a bacterial infection. And if you take antibiotics, not everybody, I'm not treating your listeners here, I'm not their doctor, you have to talk to your own doctor, but many people with peptic ulcer disease have been now successfully treated with a course of antibiotics. And what does that mean? It means that the dogma was wrong. Now, where I get my blood pressure up talking about this and advocating for patients is it is fine to encourage family members with depression or inflammation, for instance, rheumatoid arthritis perhaps, to try to eat a balanced diet and exercise and do the things that grandma and your doctor say are good for you. That's all fine, but let's not go the step too far of saying that if you just do this, you'll be better, because, sometimes that's just absolutely not the case. If the vagus nerve is damaged, for instance, and there's evidence that the vagus nerve is not functioning normally in people with, say, long COVID, where we actually have imaging studies and, sadly, autopsy studies from people who died. And there's clear evidence of the SARS virus in the vagus nerve causing damage that would reduce the signals the vagus nerve carries, which would prevent, in those patients, would prevent the off switch to their inflammatory problem, whatever it happens to be in their body. So it would be like going down the mountain and having the brakes on your car fail. If the brakes in your vagus nerve on your inflammatory system are damaged or injured or not functioning properly, then all the push-ups in the world aren't going to give you that back. So this is where I think we have to be careful. And I think this is the problem with so much advice on social media now. It's fine to encourage people to have healthy lifestyles, but it's not fine to represent that we understand all these mechanisms of action.
Yeah. No, 100%. We can't blame people for bad luck, bad genes, there's just innumerable variables, right? But
or damaged tissues. If you have a, well, I don't want to beat a dead horse, but
Yeah. Well, the inflammation thing is kind of fascinating because it's so multi-directional, right? I mean, we've had conversations on the show, like obviously, inflammation from in the body can traverse its way up, as we've discussed and impact the brain. But I mean, emotional states can in a way cause inflammation. We had a neuroscientist on the show recently who was talking about loneliness and how loneliness seems to have an inflammatory aspect to it.
The idea of inflammation, the relationship to your mental health or your view of the world, your state of happiness or relative happiness or unhappiness, is incredibly complicated and interesting and important. Let's start with why it's so hard to get a simple answer out of whatever the textbooks or the experts. It comes down again to semantics. What is inflammation? Well, inflammation, I already talked about Galen 2,000 years ago, operating on the vagus nerve in the sheep and pigs. He and his colleagues also defined inflammation, and they defined it as the redness, the heat, the pain, and the swelling that you see if you sprain your ankle or get an infected cut on your hand. Redness, heat, pain, swelling. Now, as for centuries, that was it. That was the depth of understanding. It's really only been in the last 30 or 40 years that we've had an understanding of what's happening at the level of individual molecules that are causing that redness, heat, pain, and swelling. And some of them are cytokines. We talked about that. Some of them are prostaglandins. Some of them are leukotrienes and other. So there's now a whole list of molecules that we've identified that we call inflammatory molecules, and we've made drugs, and people take these therapies to treat their conditions, whether it's rheumatoid arthritis or a sprained wrist. Now, okay, that's all fine and good, but that's an acute. We're talking about the acute pain and swelling that occurs when you sprain your ankle or get a cut on your hand. Is that the same thing that's happening in Alzheimer's disease, where you have quote-unquote neuroinflammation? Well, if you look in the brain of an Alzheimer patient at autopsy, no. You don't see those cardinal signs of inflammation, but we call it inflammation. If you look at the inflamed pancreas of a diabetic, no, you don't see, or the fat tissue in a morbidly obese person. You see cytokines. You see sometimes a few white blood cells. You sometimes might see evidence of altered blood flow, but it's not the same. We don't have the right words to describe these chronic inflammatory conditions where we're all pretty convinced that these inflammatory molecules are part and parcel of some of these conditions, chronic conditions. But it's not the same as when you acutely injure yourself. So that's problem number one. Problem number two is measuring inflammation. And this is a real problem because if you want to measure your glucose levels, you can, I don't know what's in your coffee, but if there's sugar in it and you drink that, you're going to get a spike in your glucose. And then for the rest of the day, you don't have anything sweet. You have no sugar. So you could have if your blood test was right after the sweet drink, it's going to be 150 or 120, and then the rest of the day you might be 60. So that happens in inflammation. You're going to get a spike here and a spike there. For the glucose problem, we have hemoglobin A1C, and you get that checked in your annual physical or a couple times a year, and that integrates all of those glucose exposures in the previous days or weeks or months, and you have a pretty good idea of your burden of glucose over a long period of time. We don't have that for inflammation. People point to CRP, and they point to IL-6, and they point to a couple of other things, but when you scratch through the surface, are those true predictors over time of inflammation and inflammation risk, with a rare exception, maybe CRP in high-risk cardiac patients or something, there's some predictive, but it's really not straightforward.
Interesting. So you're saying traditional markers of inflammation, they're very labile, much like your glucose.
Absolutely correct. I mean, my favorite and the one we've used the most in the clinical studies for rheumatoid arthritis that we collaborated quite a bit with SetPoint. I started the company in 2007. But the test I recommend to other laboratories who can do this, we call a whole blood cytokine assay. So you draw blood and you incubate it at 37 degrees for several hours. So now the white blood cells are still alive in the tube. And you now can add things to that tube and ask the white blood cells to get turned on and make a lot of cytokines. And so you don't have to have the patient be subjected to the cytokine production, but the white blood cells in the tube make it. And when we do an intervention study with looking at vagus nerve stimulated patients, most of these studies have been done in rheumatoid arthritis patients. But before you turn the device on, the white blood cells make a lot of cytokines, and then you put the device in and turn it on and take another tube of blood, and those white blood cells now having been treated by the vagus nerve stimulation, they make a lot less cytokines. So that's a functional test of inflammation. It's really hard to do. It takes experience, and it's not something you can do with a quick lab test in your doctor's office. But we need more tests of inflammation and inflammatory. We need a hemoglobin A1C of inflammation.
A hemoglobin A1C of inflammation. Yeah, that would be extremely helpful. Man, so interesting. The trauma community often talks about improving vagal tone as a means of healing emotional wounds. How much of that is grounded in scientific reality?
Well, very recently, the foundation for that got an enormous boost from a clinical study of PTSD patients. So this is not my field. I'm not an expert on this. I've read the study, and I know some of the folks who were leading the development of this idea. But there is a standard therapy for PTSD. It's an app-based therapy. You probably know what it is. But it's widely used, and it's pretty good. It benefits, once again, I think something like 50 or 60% of the PTSD patients who use it regularly. Well, the clinical question was, one thing that vagus nerve stimulation does when you drive the sensory signals into the brain, you can look in the brain and say, what parts of the brain got activated when I turned on the vagus nerve stimulator? Many of those brain regions are associated with emotional well-being, learning, and memory in that sort of deep brain area. So the other thing that has been discovered and is actually FDA approved is that vagus nerve stimulation therapy with an implanted device improves neuroplasticity, which is the ability of the brain to reorganize nerve circuits and build new circuits and strengthen weak signals and make them stronger. And that was FDA approved as a therapy to enhance the rehabilitation of patients who've had a stroke affecting their arms. And there's been some really significant results of people who, when their therapy is being given in time with vagus nerve stimulation, has to be timed. The device has to fire when the therapist is going through the motions of this specific therapy, that there was a significant gain of return of function in these people. So in the PTSD experiment, the question was, if we pair the vagus nerve stimulation input, so it's an implanted device, but it's timed to be activated, send signals into the brain, when the subject, the patient, is going through the routine on the app, they had a 100% response rate.
Whoa.
100%, which of course is unheard of in a clinical trial. But it was published in, I believe it was in Nature or one of the Nature journals about 6 months. It got a lot of publicity, appropriately so. It will have to be repeated, but it wasn't a small study, and it was very well done. And it has created a huge interest in this idea of vagus nerve stimulation enhancing neuroplasticity. It's funny because that idea is also goes back to some of the early work came out of Germany, I think, 30, 40 years ago. They looked at people who were walking around. They had vagus nerve stimulators implanted for epilepsy. And again, 50% of those patients don't gain any significant benefit. 50% do much, much better for epilepsy. We don't know why. We don't know the mechanism of action. But that was an opportunity for a little study. And so they enlisted patients who had the device off, and they gave gave the subject some sort of a cognitive learning test, and waited a little while, turned the device on, repeated the test, and all their scores went up. So there's a clear link between vagus nerve input and cognitive function and neuroplasticity. And the third one is that in those epilepsy patients, in the early days of the epilepsy clinical trials for vagus nerve stimulation, it was clear it only worked in half the patients. And so the surgeon or the neurologist said, well, we'll take the device out. And many of the patients said, no, leave it in.
Wow.
And that they said, why? And the patient said, I'm happier. I feel better. It makes me feel better. I don't want you to take it out. And that was the basis of the clinical trials for depression, which works half the time.
Wow.
So there's clear links, but we just don't know enough to say this input affects this brain region, which affects that brain output, which is why you have whatever.
Yeah. Does taking an ice bath actually stimulate the vagus nerve?
It depends how you do it. So if you do a cold plunge, I actually prefer just doing it in the cold shower. You take a regular shower, step out for a second, put it on full cold, and step in. First thing that happens is it hurts like hell. It's terrible. I'm sorry, I've seen these people talk about, oh, I love it. Okay, fine. There's something wrong with you if you love it.
Yeah, they're masochists.
But what I notice is at that point, it's when that initial exposure to real cold is a massive fight or flight stimulus, and this has been proved. This has been proved in laboratories, and it's been proved in studies of volunteers and of soldiers and of people in cold rooms with a fan on them and wet blankets. I mean, the first thing that happens is the heart rate spikes up and you get a massive fight or flight response. So why do I do it? Well, because that's actually anti-inflammatory. The acute massive fight or flight, those epinephrine and norepinephrine levels turn off macrophages and monocytes, and they slow down how much cytokines are being produced. And that effect can last for quite a while. So that's the first thing that happens. Now, I do stay in the cold. And anyone who's doing this for the first time, I recommend you start slowly. You don't have to put it on. You can ease your way in over days or even weeks or months. But after you do it for a while, you'll actually find if you stand there, you're aware, and you stay in the cold for a few minutes, that your heart rate will slow down. At which point you're clearly stimulating your vagus nerve. At least the fibers to your heart to slow your heart. And because it's noticeably slowed, that's pretty good evidence that you've increased your vagal tone, the amount of vagus nerve activity relative to the amount of fight or flight activity. So that's fine. Because now I'm thinking, okay, well, my vagus nerve is working harder, and that's probably also anti-inflammatory. But the cognitive aspects of it I find fascinating because I'm standing there and I'm aware of the sort of the painful cold water on my skin, but it almost feels at that point like it's happening to somebody else, like I'm watching somebody else experience it. And I think that's what people mean when they say, I like it or I love it. And because it is interesting.
It gives you like an out-of-body sensation. For me, it's a powerful state change. It's
a state change. It's almost like meditating. I'm not a monk. I can't meditate like people who do it for hours a day. But I do think there is you call it a state change. That's a good way to explain it. But it's almost like you're watching whatever. And then when you come out, it feels great.
Yeah. Oh, it feels amazing. Now, do you have to immerse your entire body? Because I know some people, there's some, at least anecdotal evidence, or there's the presumption that just dunking your face is sufficient to stimulate the vagus nerve.
So you have 200,000 fibers. Which one do you want to stimulate?
Right.
So I think if you put your face in a bowl of cold water, you're holding your breath. And you can do that in the shower too. You can hold your nose and hold your breath and just look up at the cold water in the shower. Now you're activating, the idea there is the cold on the skin of the face will activate the diving reflex.
Okay.
And the diving reflex, of course, is the reason that a little baby falls through the ice in the winter and sinks to the bottom of the pond and is down there for 20 minutes and comes up and is pretty normal.
Wait, what is this? So explain that?
So the diving reflex is the physiological mechanism that seals and other aquatic animals living in cold water that they use, or whales, when they dive. And so what happens is they come up to the surface, they take a big breath of air, and when they dive back into the water, the cold water on their face and the cold temperature of the South Pole Ocean, the Arctic Ocean, the South Pacific, that these combined effects of cold and breath holding slow heart rate down to exceedingly slow levels. It slows metabolism, slows heart rate, and slows oxygen consumption, so that these animals can stay underwater for a long time. Well, we have vestiges of that reflex, and there's dozens, maybe probably hundreds, of examples of little children. It's little babies or little kids falling through the ice, going down to the bottom of the pond in a freezing cold pond, being rescued and resuscitated and having absolutely no deficits.
Whoa.
And that is almost certainly because they have activated a diving reflex, and it's probably stronger in babies than it is, and you probably lose it, much of it, by the time you're a teenager. But yeah, that's very well documented. But it's not as simple as I've stimulated my vagus nerve. That's where it breaks down, because once again, the influence of the cold on the skin activates fibers in a different cranial nerve. The vagus nerve is cranial nerve 10, the pair of vagus nerves. You have cranial nerve 5 is called the trigeminal nerve, and you have 2 of those, and they innervate the skin of your face. And so when the dentist numbs your teeth, if it's a big job they're doing, they will often numb a branch of the trigeminal nerve, and that's when your whole jaw goes numb.
Hate it.
So that trigeminal nerve is sending the signals into your brain about the cold. If you hold your breath, because you're probably going to hold your breath if you put your face in a bowl of cold water or look up at the shower, if you hold your breath, now we went back to what we talked about before. You've changed your breathing. So you've absolutely changed the input signals in your vagus nerve from your lungs to your brain. Now, once these signals are in the brain, here's the part that everybody overlooks when they talk about do this, that, or the other thing for your vagus nerve. You have 100 billion neurons in your brain. You have trillions of connections. And at the end of the day, every nerve in your body is connected to every other nerve in your body. So, yes, you have activated a diving reflex. Yes, your heart has slowed. Yes, you have activated signals in your trigeminal nerve. Is that it's just absolutely not the same as what we do as a therapy in putting a device on the vagus nerve in the left neck at a particular time and place.
It's just fascinating, though, evolution, the cheat code of like, okay, let's press a few buttons here on the vagus nerve, let's press a few buttons here on the trigeminal nerve. We've deduced that you're suddenly plunged into ice cold water, and it activates this
in milliseconds.
Yeah,
in milliseconds, and it's all coordinated. And that's, I think if you get your head around that you have let's try it this way. Every cell in your body is surrounded by neurons. So if I were to submerge you in a tank of magic goo that dissolved all your cells but left your nerves intact, and we would pull you out with the crane, and we pull you out, and you would still be Max. You would still look like Max, because you're a walking neural network. And so you've got a walking neural network in your body that is all the organs sending all this information to your brain, and all your muscles and all your nerve endings in your skin and in your gut, watching what's happening to your microbiome and to your glucose. All that information is going into your brain, but your brain is responding to all of it. Or at least it's responding to the deviations. It's the old it's the old, how do I hear a conversation in a cocktail party? The brain is great at ignoring the background noise and picking out the signal. And so that's how it works. And so it's fine that everybody's interested in the vagus nerve. No one's more interested in it than me, believe me. But we just have to be careful about what we know, what to be true, what we know to be false, and where we should be really doing. I'm trying to get people interested in doing more large, well-controlled clinical trials because, frankly, in the history of medicine, that's the only thing that makes an impact, is when there's enough data to say this is a mechanism of action in the lab, and this is what happens when we give it to 200 people with this condition and 200 controls. And then you have carefully done studies where you can draw important conclusions. That's how you make an impact, not by saying, oh, buy this TENS unit and your vagus nerve will be better. You got to be really careful with that.
No, we need more gold standard science, absolutely. But that's actually a great segue to my next question. Does heart rate variability actually tell us anything meaningful about vagal tone, or is that just an oversimplified proxy used to sell, biotrackers and stuff like that?
No, it does. It does. Heart rate variability, if done correctly, can be indexed to the background activity of your vagus nerve, particularly in the high frequency power spectrum analysis. So let's talk about where that could go wrong, and why. Once again, if you're going to spend money on a device, you kind of want to make sure you understand what you're getting and how the device works. So heart rate variability, simply put, is a way of statistically analyzing data from an EKG signal, or another way of measuring the pulse could be through blood pressure, but just say EKG to keep it simple. So the way it works is every time your heart beats, there's some time that goes by until it beats again. And the time between heartbeats varies. Sometimes you can feel your own pulse. Sometimes your pulse will go boom, boom, and sometimes it will go boom, 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 boom. That variability is essentially heart rate variability. In order to analyze it, there are a whole series of algorithms that have been developed for a long time, many, many decades, by physiologists. And those algorithms can be subjected to complex math like fast Fourier transformations and other sophisticated mathematical formulas. There is no clear consensus within in the device universe on the right algorithm. And you can have wearable A or watch B or wearable C or watch D, and they would all tell you your heart rate variability, but they could all be using different algorithms. And so that's really, really important. There's nothing wrong with following heart rate variability. If you can find easily online the fact that heart rate variability tends to decline with age. There is pretty good epidemiological evidence that having a higher heart rate variability by most of these measures, whether it's high frequency power in the vagus nerve topic that we're on today, or some of the other measures that are attributed to vagus nerve tone or vagus nerve activity, that the higher those numbers are in populations, there is a suggestion that is associated with longer lifespan or health span and a better cardiac function. Does that mean that your vagus nerve is healthier? Maybe. What you're actually looking at is in heart rate variability measures is you're looking at the pushing of the vagus nerve, which slows the heart, against the pushing on the heart of the fight or flight sympathetic nerves, which increase the heart. And you're actually looking at that variability between heartbeats. You're actually looking at this pushing one way or the other from sympathetic and parasympathetic. The point is it's really complicated, and until we have sort of gold standard studies, again, done in large numbers of people that are well controlled and replicated, it's hard to make a concrete recommendation other than going back to what are the things that tend to increase heart rate variability. Eat a balanced diet. Don't drink too much alcohol. get a good night's sleep, exercise regularly, down the list of things that grandma and your doctor should be telling you to do. So there's nothing, I have a wearable and I have a watch and I like to look at my heart rate variability and I like to watch it go up when I meditate or do various breathing. For me, it's a Pascal's wager. I do all these things because I don't mind doing them. And it may be reducing the amount of inflammation I have. So, for instance, my hope would be that the increased heart rate variability, which we know is measuring the influence of the vagus nerve on the heart, would also be a sign that the vagus nerve signals to my inflammatory system are also increasing. We don't know that.
Yeah.
But maybe that's what's happening, and so it's a Pascal's wager. If it works and I don't have too much inflammation and I'm healthy to be 100, great. And if it doesn't work, I'll never know.
Well, no, you're definitely, this is fascinating. The heart rate variability question, it's something that comes up a lot. Again, in social media, you hear a lot made of it, but I didn't realize that the science wasn't as settled as it's often made out to be.
The science is settled from the people selling the device. They will tell you this is the best way to measure heart rate variability. But my colleague Sangeeta Sivan and I, we run the lab together at the Feinstein Institute in New York. Years ago, we actually worked with one of the leading experts on HRV in the world named Richard Sloan at Columbia University in New York. And we worked on building a new device to measure heart rate variability. I think this was 20 years ago. And it was a laptop because it was a prototype. And and I remember we were looking at the tracings. And we would record, this is the other incredible variable in all of these things. We were pretty convinced you had to have the subject lying still. You got different measures if they were sitting up or lying down. And you got different measures if you measured the heart rate variability, the EKG signals for 5 minutes, 10 minutes, 20 minutes, or 24 hours. So, okay, let's do 20 minutes because that didn't seem too bad. But this patient had an ectopic heartbeat. A lot of people have ectopic heartbeats. It means that the EKG spike doesn't look like it's supposed to, and the heart kind of skips a beat. Doesn't mean they're sick. It's a normal physiological thing that happens if you look at any population study. Well, if it's not a heartbeat, you have to subtract it from your analysis when you're adding up all the interbeat times, the number of milliseconds between heartbeats. So I remember when I said, okay, we're done with this project 20 years ago, was when we subtracted like 3 ectopic beats from a 20-minute recording, and it completely changed the measured heart rate variability. That to me was so not obvious. You would think a heart beating at 80 beats a minute for 20 minutes, you're looking at a lot of heartbeats. Subtracting 3 shouldn't have had a huge effect on this, but the mathematicians explained to me it absolutely does. And I've been suspicious of HRV ever since, especially when. So what there is not agreement, I think, on heart rate variability across all these wearables. There is agreement for laboratory-based or some doctor's office-based assessments of HRV done, like I said, supine or sitting, always done the same way, always done with the same computer algorithm, and always done with collecting the EKG in the same way. You can do it, and there are people who swear by this method or that method. Whether and how that's all been applied to all these wearables, I'm not convinced.
There's also like individual variation. Like my understanding of it, which is amateur at best, is that your HRV might improve or decline over time based on lifestyle factors like exercise and whatnot. But comparing yours to somebody else's, it's sort of like apples and oranges to some degree.
I think that's probably true, and it may be from what we're talking about. It may not be the difference between the people. It may be the difference in the wearable, or the position, or the algorithm.
Yeah.
So it's fine that everybody's interested in this. It's great, actually, right? I think if the answer is it encourages people to pursue a healthier lifestyle, and it's a way, that's all good. I just think I keep asking my colleagues to dive in and do more work. See, we could talk about that for a second. Why hasn't this been studied in huge clinical trials, and why don't we know all these answers? Well, it's expensive.
Yeah.
If you any clinical trial of 100 or 200 people, which are the kind of numbers you'd really need to have it make a convincing, lasting impact, that's going to cost millions of dollars.
I mean, why couldn't you get one of these wearable companies to fund it?
Well, why? They don't have to. They're selling their devices without the data.
Yeah.
They have data that they're not sharing.
Hmm.
They're not putting it out there, subjecting it to peer review.
I mean, they should. Like, why not? You know?
Well, you know why not.
because then what? The results of the analysis could be counter to what they're promoting.
I don't know. I mean, it's there's a lot of talk about science these days, and the difficulty of doing science, the difficulty of paying for science. These are the kind of things that don't necessarily generate a profit margin out of the box. You know, if you and I were to figure out how the diving reflex is related to heart rate variability using this wearable versus that wearable, we maybe have made an important physiological discovery about how the human body works in the context, but we're not developing a new product. So at the end of the day, you need a lot of resources to answer these seemingly simple questions. That's all fine, as long as people buying their various devices understand the limitations of what we understand about the scientific mechanism. There's a lot of pointing at scientific mechanisms that doesn't pass rigorous scrutiny as that we really understand it.
Amen. If you had to leave my listeners with one takeaway, one tool that they can use to improve their vagal tone, evidence-based, non-woo way to improve their vagal tone starting today, what would that be?
Get 8 hours of sleep, or 7 or 8 hours of sleep. Meditate and find a way or find some other strategy to reduce excess stress in your life. Focus on the things you can control, not the things you can't control. Eat a balanced diet, exercise regularly, watch your weight.
Those are the big levers.
They all tend to slow resting heart rate. At the end of the day, in the Framingham study, the big study outside of Boston, many decades following people with various conditions, the Framingham study was really the big study everyone knows that revealed the dangers of cigarette smoking on heart disease. In that study, it revealed something else. On a population level, populations of patients, groups of patients that had a slower heart rate lived longer than patients that had a faster heart rate. Now, for your listeners who just checked their pulse and said, my pulse is 85 and I want it to be 60, does this mean I'm going to die? No, it doesn't. There are a lot of people with you can't take a population description and apply it to an individual. But on a population basis, resting heart rate, a slower resting heart rate, was proved in that study, replicated in an even bigger study in France, that people with populations with lower heart rates live longer than populations with faster heart rates. The thing that slows resting heart rate is the vagus nerve. So focus on healthy lifestyle things under the guidance or permission of your doctor if you have an underlying condition, and take a bow when you lower your heart rate a couple of beats.
But that doesn't mean that acutely raising your heart rate, like with exercise or sitting in a sauna, are bad for you. In fact, the inverse is likely true, right?
The inverse is likely true. It goes back to the acute exposure to cold, where you have a massive fight or flight response. You drive up your heart rate, you drive up your blood pressure. Again, if your doctor gives you permission to stress your body in that way, even acute exercise. Well, that's another thing we can leave your listeners with. The textbooks are wrong when they say that when the fight or flight response is on, your vagus nerve response is off. That's false. And the best proof of that came not long ago, in the last couple of years, from a research study in New Zealand studying sheep exercising on a treadmill. So they've got these sheep in the lab running on an inclined plane. I imagine a Far Side cartoon. And the sheep are running away. They've got them all wired up. And what they find is that as the sheep do their workout on the treadmill, yes, there's a significant increase in norepinephrine, epinephrine, and heart rate. That's fight or flight. But they also had wired up the vagus nerve in those sheep, and that was also activated, not inactivated. So exercise, these conditions of acute fight or flight, is exercising both the sympathetic and the parasympathetic. And here's what's amazing, Max. When they either cut the vagus nerve to the heart in those sheep or blocked it chemically, the cardiac function got worse. So the sympathetic input and the parasympathetic input on cardiovascular cardiac output and coronary artery blood flow, and I think blood oxygen was another one, they were helping each other. They were working synergistically, not in opposition. How many times have you seen in discussions of the vagus nerve, fight or flight versus parasympathetic, that they act in opposition? No. No, when you're exercising both of them in synergy.
Wow.
And I suspect that's probably true for most everything else, that the vagus nerve and the sympathetic and vagus nerves are doing together to control your organs. I think they're acting together.
Well, it just underscores the value of exercise. I mean, and how balancing it can be to so many systems in the body, if not all of them.
100%.
So when you're running on a treadmill, for example, your heart rate obviously shoots up through the roof, and you want to train through all of these different modes of intensity. But what ultimately will happen is that there's a rebound effect, and that might lead to, over the long term, a slowing of your resting heart rate.
That's exactly right. So remember, even though what you see is an increased heart rate because you're giving yourself that workout, you're also working out.
You're not shortening your life with every exercise
Absolutely
session.
not. You're probably lengthening it. You're probably extending it. But that when you see that heart rate go up during that workout, you're also working out your vagus nerve. You just can't see it because the predominant influence there is the increasing of the heart rate. There is a very popular measure of autonomic function. So the sympathetic and parasympathetic, of course, are autonomic. That's the autonomic nervous system, as in autonomy. Those, when we talked about needing a hemoglobin A1C for inflammation, and there's an evolving field looking at how to best measure whether it's heart rate variability or other indicators of vagal tone. And it is actually, when you ask after exercise, you've driven your heart rate up, how fast does the heart rate recover to normal, and over how many days or weeks or months of exercise training do you have to go before you see an adjustment or a slowing of your resting heart rate? Those kind of questions, exercise physiology questions, are very interesting, and we don't have all the answers to those. Again, it's kind of an obvious question, right?
Yeah, but how quickly you recover?
How quickly you recover, and how quickly does the balance restored to easy breathing and resting heart rate after you do an aggressive workout? There's big variations in that. Some people recover very quickly in minutes, and some people recover more slowly. And are those people that recover more slowly, are they at higher risk of disease? Maybe.
Is there a nomenclature for that? Like, is there a term for the rate of recovery that might be measured, or is that just?
I don't know that. No, I don't. There probably is. I don't know what it is.
Got to ask Andy Galpin that. He would be a good. He's an exercise.
Yes, he would know.
Yeah, he would know that. Well, Dr. Kevin Tracey, this was so fun. Is there anything else you want to leave my fantastic, brilliant audience with before we go? It's not. I mean, your body of work is so impressive and so important.
Well, we did capture it in a book called The Great Nerve, and the idea of the book is to capture much of what we talked about today and a lot more in a way that is accessible for people to learn about the vagus nerve, and especially for patients who may be able to benefit now. Today, if it's rheumatoid arthritis, there's 1.5 million potentially eligible patients in the U.S. who could benefit from knowing about this, and maybe even from having a therapy with a vagus nerve stimulator. And in the coming years, I think you're going to see an explosion of work around using this vagus nerve-based therapies to treat other conditions. So one of the chapters in the book is called FAQs, and the questions are for the patients to ask their doctors, and the answers are for the patients and the doctors.
Love it. Yeah, I'm super excited for the implications of this work on autoimmune conditions, for healing emotional wounds. It's just crazy, and I feel very much that we're just at the tip of the iceberg.
We are. This is the beginning of an era where people will be treated with battery-powered devices instead of injectable drugs that cost $100,000 a year and have black box warnings. So I think it's going to be really interesting.
Maybe even potentially ending certain neurodegenerative conditions like Parkinson's.
Those are research topics, and yes, we can hope so.
Fingers crossed. Well, where can people pick up? I've got one last question for you, but where can people pick up your book? And are you on social media? If so, drop your handles for my listeners.
Well, you really want me to say they can get it anywhere books are sold? Because I love saying that. Yes, anywhere books are sold.
You got a book out. You got to sell it.
Yes. And I really appreciate you having me on, Max. It's great to be here.
Of course. The last question that gets asked to everybody on the show, what does living a genius life mean to you, Dr. Tracey?
It means being grateful for the opportunity to build teams of people, work with teams of people on ideas that are important, and will leave the world better than we found it, we hope.
Amen. Couldn't have said it better myself. Well, thanks for coming out. I know you've flown a long way to be here, so appreciate your time.
Thanks for having me on. It's great to be here. Thank you, Max.
Of course. Thank you guys for listening. Share this episode with friends and loved ones who may benefit from it, and I'll catch you on the next episode. Peace. Hey, if you liked that video, you need to check out this one here, and I'll see you there.